Antihistamines refer to a group of drugs that block the action of histamine in various inflammatory and allergic conditions. But before we look at these drugs, let's first look at how histamine works. Histamine is a chemical that mediates the start of inflammation or an allergic response. Therefore, it's called a chemical mediator. Now, by far, the most common location of histamine is within an immune cell called a mast cell, which is located under the skin or in the mucosa, such as the respiratory tract or the gastrointestinal tract. Mast cells can be stimulated to release histamine by a number of things, such as tissue injury, allergens, cold temperature, and certain drugs like morphine. But because this video is focusing on allergies, let's look at allergens. So let's say this person has hay fever and is allergic to pollen. If pollen was to enter the airway, it would go into the nose, the eyes, and the throat. The pollen will then bind to the mast cell, which is already sensitized to it. The mast cell will then release its histamine, or known as degranulation, which then wants to bind on its specific receptor. There are 4 types of histamine receptors, H1, H2, H3, H4, but for allergies we're focused on H1. H1 receptors are located in blood vessels. When the histamines bind to the receptor, it causes the blood vessels to dilate and become leaky, which would cause the red eyes and the runny nose, and the leakiness would then lead to sneezing. The blood vessels dilating on the skin would also lead to the urticaria or the rashes. The histamine would also bind to receptors on smooth muscle, which would close in the airway and make it hard to breathe. And the histamine would also bind on nerves, causing itchiness and pain, and that would cause the itchiness in the hay fever response. Now, there are certain drugs that can stop this action or allergy occurring, and these are known as antihistamines or H1 receptor antagonists or blockers. There are 2 types, first generation and second generation. The first generation category are more lipid soluble, so they can cross the blood-brain barrier easier, therefore they can affect the brain, specifically causing drowsiness. So these drugs are less commonly used for allergies now. However, they do cause some other effects which can be of benefit. The first drug, chlorphenamine, can be used in more emergency setting allergies, whilst promethazine or phenergan is actually sometimes used for its sedating properties, whilst cyclizine, sometimes known as nausicaam, can be used in motion sickness and for nausea and vomiting. The second generation category don't cross the blood-brain barrier as easy, therefore they are generally known as non-drowsy antihistamines. Some examples are cetirizine or Zyrtex, loratadine or Claritine or fexofenadine or Telfast. These drugs are heavily used for hay fever, therefore allergic conjunctivitis, allergic rhinitis, and for the skin, urticaria.